Hey guys, today is January 24th, 2022. So I'm actually going today for inferior turbinate reduction surgery. So basically in my nose, I've always had one side or the other that gets blocked. So depending on which way my head's kind of tilting, or sometimes depending on what kind of food I'm eating, some sides of the nasal passages get blocked. At the moment, my left side is completely blocked. My right one isn't too bad, but I've had this problem for many years. So since I was young, since I can remember, never been able to breathe through both sides of the nostril at the same time. So I'm going today to do a turbinate reduction. So I had to do a COVID test on a few days ago, Friday, so 3-4 days ago, and it's all come back as negative. So the surgery is going to go ahead. So yeah, I'll update you once I've had the surgery. Oh yeah, and just one thing to mention, always used to get a bit of a runny nose. So if I'm exposed to things like dust, my nose just starts running like crazy. Sometimes if it's really strong paints, like the glossy ones, then also my nose just starts running really bad. I sneeze quite a lot. I can't really go outside without a tissue. As you can hear, my voice is a bit croaky as well. I feel like some of that might have come from the fact that I've had to maybe breathe through my mouth more so than my nose over the years. So I'm wondering if it kind of helps with those situations. The other thing is I haven't been on a flight for a number of years, but when you go on a plane and you start descending, I used to get this really, really bad pressure right behind my eyes and like here in the head, where it's like somebody is pushing two concrete blocks on both sides of the head. And it's extremely painful. I don't think I've been through much things more painful than that. A way I learned to cope with that specifically is to always, I never go on long flights without having chewing gum with me. So when the plane starts to descend, I always have a chewing gum. Otherwise, I get this really weird like sinus pressure as well. I haven't had it for a good number of years, thankfully, just because I always carry some chewing gum, which I think is supposed to maybe help the whole sinus area drain. And I specifically take something like airwaves as well, um, just so it has some kind of pushes the air up the nose, I guess, a bit more than just nothing. So yeah, I'm hoping the surgery helps with that. So it's supposed to be about just under an hour long, and he's going to reduce both sides. One thing I asked him about was the empty nose syndrome or whatever that's called, but he told me it should be fine because he's just going to cut inside and then he's going to remove some bone manually, without using any of those like fancy tools like a micro debrider. And he specifically said, yeah, that was a bit of a fancy tool. So he's going to try and preserve as much of the lining on the inside and just take out, like he said, about a third or 30% of the bone inside. So it should open up the passageway quite a bit. Yeah, so I'm looking forward to getting it over and done with. Hoping that there's a longer term benefit as well. So yeah, let's see after that. Hey guys, just give an update after the inferior turbinate reduction surgery that I went through. So I went to the hospital on the 24th, Monday. So I had to wait for about 4 hours there. So it took ages for it to get started. They put me under general anesthetic. I actually didn't really see the surgeon for more than like a couple of minutes, which was a few hours before they put me to sleep. And then they did the surgery. The surgeon disappeared, and then yeah, just like left there in the bed. So I slept overnight. They put this kind of bandage on and pack in the first night. So they put something quite deep inside the nose. It was pretty painful on the first night, so first few hours. So I was on the painkillers at the time. Um, since then, it's been a bit better. As you can see, it's still kind of bleeding out. It's only the second day um, after the surgery. So it's been about less than 48 hours. Um, but yeah, I mean, it's still bleeding out. It bleeds out if I like moving around, so I'm just trying not to move so much at the moment. Yeah, so the consultant basically said to rest up, don't move around too fast. So I'm just going to continue to do that, and hopefully the bleeding doesn't come out as much. But in terms of pain, it's not really been that painful. Since I come home, only taken one painkiller, so one ibuprofen yesterday. Um, but yeah, so far so good. It's bleeding. Feel like it's bled less over the last night versus the night before. So I feel like it's heated up. It looks quite messy because I think I slept on one side and the blood's like poured over there. But yeah, hopefully I can update you in a few days if the recovery continues to go well. Hey guys, today is Thursday. It's 3 days after the operation. So this morning quite a lot of snot came out on one side, which is pretty clear. The other side is still quite congested. Overall, I'd say it's still congested, but it's just about um, clear on one side. So yeah, quite a lot of snot came out, and like the biggest bogey ever, like the size of the whole nostril, basically in the morning, that I took out on the right side, which clearly all in one go. So I'm hoping the left side gets clear pretty fast. There isn't much pain. The only thing is there's a bit of a more of like a sinus kind of headache. It just feels like a lot of air pressure inside all of the cavities, I guess, underneath where the nose is. It just feels like a lot of air sometimes. That's going all the way up to the head as well. So yeah, trying to see how that goes the next few days. Hopefully the left side will clear up and both sides will be fairly clear. I haven't really put anything in the nose, no sprays or anything like that so far. I've just been changing the dressing every twice a day, just to keep it kind of clean. Um, yeah. Hey guys, so it's been 3.5 days since the surgery. Um, it's actually today I've been able to clear out most of my left side, and the day before that I managed to clear out a lot of the snot, blood, and all this kind of shit from the right side of the nasal cavity. Today it actually feels pretty good. The bleeding has kind of stopped. There's some running mucus and stuff, but very little blood from the left side so far. As I said, I cleared a lot of that out earlier. I'm starting to feel better, so I can actually breathe through both nostrils for the first time ever. So that's good. There's still some congestion there, so hopefully it'll just continue to improve as time goes on. Yeah, one thing I would say, maybe in the first like couple of days, would be try and avoid anything with like pepper or like some spices, that kind of thing, or anything that you think that will make you sneeze, or even like chili and stuff. So um, I actually had something that was like not even that spicy, um, and then it just like made me sneeze, and all this like snot and crap made it come out on the, I think it was on the day that I came back from the hospital. So I'd be very careful what you eat the first couple of days, and just try and eat light. The other thing that's improved significantly has been being able to drink liquids. I think the first like 1 or 2 days where I tried to have a lot of water, just the way you kind of swallow makes you want to take air more from your nostrils, so you can feel all your like your bogies and all your mucus kind of bubble up a little bit. So that went away after like the second or third day, so it was much easier to drink water after that. So yeah, I luckily increased my water intake by quite a lot, and I feel good. Been taking like a probiotic with the breakfast in the morning as well, just to make sure I don't get like constipated because I'm not moving around that much. I haven't really gone for a walk or done any exercise, anything like that so far, but hopefully within the next couple of days I might try and go for like a small walk, nothing like too crazy. Um, but yeah, so far so good. Hey guys, it's been 1 week and 4 days since I've had the operation in the nose. So yeah, I had the inferior turbinate reduction it was about 1 week ago in like 3 days. So today is Friday, and I had my operation a week and like 4 days ago on a Monday night. So it's feeling much better. For the first time, both of my nostrils are clear, so I can actually breathe through my nose. So it's actually starting to feel really good. This week's just been less and less congestion. I don't have so much blood anymore. Actually, I haven't had any in the last like 2-3 days, which is good. There's got a lot of like dry skin and stuff from having that mask on for the first week or so. I think I removed the mask from the Saturday, so I had it on for about 4 or 5 days. But after that, it was fine. And then throughout the week, like I had one side's been clear, one side's kind of been blocked, and then it's changed around a bit. But at the moment, both sides are pretty clear. So I just got out of the bath. So it's quite warm in there, a lot of steam. So starting to feel good. But to be honest, throughout the day, both sides remain pretty clear. So I'm really happy with the benefits, and been just getting used to breathing through my nose and not through my mouth. I think having so long of breathing through my mouth, I'm not even used to having my nose clear. So I've started to use that as a means of breathing instead of my mouth. And then I also haven't been using my inhalers as well. I'm trying to avoid using this budesonide. So I carry one of these budesonide inhalers. So I haven't needed to use one of these since I got back from the hospital, which is great. I want to see if I can avoid using that um, as long as possible, and then just see how long I can last with that. And then my next follow up is in about 2-3 weeks time. So I think today is like the 4th or 5th of February. My appointment's on the 28th, so be interesting to see what the consultant has to say. Been trying to go for a walk a couple of times in the week, but that hasn't gone so well. Like inside of the nose is pretty sensitive. So when I went in the first time, which was on the Monday, um, I started to get like a bit of blood started to come out on one of the sides, so I cut the walk a bit short. When I went out, I think a couple of days before today, so on the Wednesday, I had like a bit of just a runny nose, but it wasn't blood or anything like that. So I think it just could be like allergies and stuff flaring up. So yeah, it's good. I think in maybe tomorrow I'll try and go for another walk, and then in a few more days see if I can go for a longer walk and see how it holds up. I think I'm gonna hold off doing any kind of like extreme exercise until I see my consultant. So probably might try and avoid it until March. So it might be 1 month without doing any workouts. Yeah, which is a bit of a pain because I've been off work for 2 weeks. My company's been quite good. They're giving me a sick leave for 2 weeks just for all this to repair. But yeah, I'm back into to work next week, working from home. Um, and then yeah, I just gotta wait for my follow up, and then yeah, I'm looking forward to getting back to working out. Looking forward to see if I can push my runs. So I always do 5k. See if I can bring the time down finally, and then also play a lot of football. So I want to see if it helps with stamina that way as well. Yeah, the other thing I would say is I've had some sinus pressure as well. I think this is normal, just getting a lot more oxygen in or air in through the nose. Sometimes it feels like a bit of not stuffiness, but just like a bit of pressure around here and about like right behind the eyes. So I think it could just be just more air getting in through the body, and just me probably getting used to it. So yeah, hoping that it just continues to improve in the next few weeks, and then yeah, hopefully I can give you an update after a month or so. Alright, thanks for watching. Hey guys, just a quick update on the video after I had the turbinate reduction surgery. So it's been about 4 weeks and 2-3 days since I've had the surgery. To be honest, feeling really good now. I don't get that much congestion generally. The nose is like really mostly clear. The only one kind of thing that's a bit of a weird sensation is you get this kind of, I don't know what, it's like a weird smell or something that you can like almost smell inside your nose. I don't know, it reminds me a bit of like smelling your own snot or your own like pus or something, like really gross. I get that sensation. It kind of smells like after you have the surgery and you've got all of that crap that's still clogged up. You get a bit of that like every now and then, but it's like kind of diminishing as time goes on. But that's pretty gross, to be honest. But generally, like the benefits have been really good. I'm not really getting runny nose or anything like that. The nose is pretty clear. I haven't had any blood after like week 3 or so. Very, very rare. Feel really good. It feels like after about the 3rd week, so I'm from the UK, and it was quite cold. It gets cold here. It's in the winter, so there was a bit of sensation. So when I was going outside, like I think it's a scar tissue or inside the nose would feel quite sensitive. So like that part of the nose would feel really cold when I was going out and about for a walk. Um, but now it feels fine. It feels like kind of used to it. Wear a mask sometimes because of COVID-19, but it's not like there's any pressure on the nose or anything like that. So overall, pretty good. Definitely recommend this. I got my follow-up appointment on Monday, and like right now, both sides of the nose are completely clear. So it definitely feels good. Um, yeah, so I recommend this. I got my follow-up next week Monday, and hopefully I get the all clear now to start exercising again. That's the one thing I've avoided, so no exercises so far. Just go for a walk here and there. Can do like a long walk and go outside in the cold now without any issues. So yeah, the next step is just to go for the follow-up, make sure everything is all good. I don't know what he's going to do on Monday, if he's going to like take a camera inside or what. But once I have that, if he gives me the green light, then can get back to exercising and hopefully really push it, and then hopefully I could do an update in a few months time and see how it goes. Right. Hey guys, it's been 2 months since I've had the operation for inferior turbinate reduction. So the date is March 30th. I had the operation on January the 24th. So yeah, it's been a couple of months. Started to get back into exercise and stuff, so started to run, play football as well quite a bit. I have to say, like, I think it's made a massive difference in terms of overall like stamina. After I went back to playing, I think I had like maybe like 1 or 2 rounds of exercise, or like an exercise bike and maybe 1 jog, but I felt that my stamina is much better now that I can breathe through like both sides of the nose. One thing that I'll say is I actually still had some scabbing that was a bit left over. So only a couple of weeks ago, I actually had a wad of like blood and like scabbiness come through. I had this like weird, like foul smelling sensation off my left side, that kind of like lingered on for like a month and a half or so. And it's only a couple of weeks ago where it like I just spat out, and like it was like yellow and bloody kind of crap just came out of my nose. It was like a pea-sized scab. But since then, actually, my left side's been completely clear. I think last time I recorded the video, I said one side was still a bit congested at times, but now it's mostly clear on both sides. So I'm feeling much better. My asthma feels better controlled as well, so I haven't had to take my haven't had to take my inhalers that much, which is great. So overall, much better. Still take like the sea salt sprays every now and then. Still take my brown inhaler. I take the budesonide one, but I don't feel like the need to take it as often as before, which is great. And yeah, I just feel like overall health wise better. My skin, I think, is feeling a bit better as well. And yeah, really happy I had the operation. We'll see how the next like several months go, but I'm really happy with the results. I think it took a few months for it to all heal, so I think like about now I would say maybe 2 months to fully heal up both sides and breathe quite well. But since then it's really good, so I definitely recommend checking it out. I went through a consultant, so I'm in the UK, so luckily I had some insurance through my employer, so I went through a private guy. He tried to prescribe me different nasal sprays at the start. None of them really worked for me. It's something that I also tried when I was much younger, so when I was a kid, and like looking at back at my medical record like in the 1990s through my parents and stuff. But yeah, that never worked. So after so many rounds of trying nasal sprays,
that just didn't do it for me. And I think the surgery, although there is like a few weeks required to heal, um, and a few months required for it to properly heal. Sorry, a few months required to properly heal. Um, Once you're kind of over that period, I feel like there's a massive benefit for that. So I definitely recommend getting it checked out and seeing if you can do it through your insurer or through your medical practitioner. So I went through a specialist as well, and went through a private hospital in the UK to get it also done through the NHS. I don't know the procedures on that, but when I saw the NHS GP, they just wanted me to keep taking the sprays and then come back. And then I don't know if this surgery is available through there, but obviously if you're watching from abroad, then your processes are going to be different. But yeah, I went through a ENT specialist, and he was really good. So yeah, really really pleased with the result. This might be the last video I make on this, but if you guys have any questions or anything, I'll try and respond to them in the comments. Cool, yeah, but thanks for watching my series. Take care.